Welcome to the Probate Nation. Whether you are caring for an elderly loved one as a court-appointed guardian, or as an agent named in an advance medical directive, or just helping out without any of those authorities, your primary goal is to provide your loved one with the best care possible as they age. There are many challenges in addressing the need for that care. Tonight we will discuss two options you should investigate. One is palliative care. This is holistic, person-centered care that addresses the full range of medical and non-medical needs for a person who is aging but is not near death. The other is hospice care, which is provided near the end of life. While this care is not about giving up, continuing curative treatment is discontinued. Rather, hospice care seeks to maximize the comfort and quality of life for your loved one. We are pleased to have as our guest tonight an attorney for the National Hospice and Palliative Care Organization. He will serve as our guide as we discuss in more detail each type of care. Our guest is a lobbyist for the National Hospice and Palliative Care Organization, which is the largest nonprofit membership organization representing hospice and palliative care programs and professionals in the United States. He worked as a prosecutor and in private practice civil litigation attorney for several years, and then as a lobbyist for other organizations before joining NHPCO last year. Please welcome Mark Slobodian from the National Hospice and Palliative Care Organization. Hi, Mark.
Thank you, Richard. Thanks for having me on the Probate Nation.
Thanks for coming over to share this really important information. You know, so many people are taking care of people as they get older and trying to take care of them in the home. You know, hospice and palliative care is one of those real important tools in the toolbox we want to take a look at. But let's begin by, tell us a little bit about the National Association of Hospice and Palliative Care, about its members and its mission, if you would, please.
Yeah, so NHPCO, or National Hospice and Palliative Care Organization, is like most trade organizations. We represent our members who are professionals and providers who provide hospice and palliative care nationwide. We comprise of about 56,400 frontline care providers and about 1,200 members, which includes about 4,000 hospice locations in the country. And what we aim to do is provide the best care possible for patients and families when they enter into both hospice or palliative care. And that includes best practices, education, as well as legislative work and regulatory work and advocacy work affiliated with those.
Okay. So how many hospice providers are there in Metro DC area?
There's around 20.
20, okay.
They are affiliated with different organizations. Some are in-house at hospitals, some are standalone facilities.
Okay. And on the other hand, how many palliative care organizations or providers are there in the metro area?
That's harder to pin. Most hospitals have a palliative care practice, and some hospices do as well, but not all of them.
Okay. Well, let's dive in to understand a little bit about hospice, okay? So what is the focus of hospice?
We would say that it's person-centered care that deals with not just the symptom relief, but the psychosocial care that a person needs at the end of their life. Okay. It is a sort of a care philosophy that sort of originated about 40 years ago and has been part of the Medicare hospice benefit since 1986.
Okay. And who is entitled to receive this type of care?
Anyone that has been certified terminal and has 6 months or less to live. That's the way the Medicare hospice benefit works.
Okay.
The private insurance benefit works a little differently. Medicaid works about the same.
Okay. And how many people are receiving hospice care annually right now?
About 1.5 million people in the United States receive hospice care in a given year, and about 50% of Medicare deaths occur in hospice.
Now, I know when we were preparing for the program, apparently during the early years of hospice, most of the people who actually were receiving hospice were cancer patients. Has that changed in recent years?
Yeah, well, you remember hospice was created in the 1980s, and it was cancer and AIDS was a lot of the sort of terminal illnesses that people developed around this philosophy of care. And what has happened is most illnesses, in terms of the trajectory of cancer, is a lot longer than it used to be, as well as some of the trajectory of some of the other illnesses that strike older people, like neurological diseases like Parkinson's, Alzheimer's, and the list goes on.
Sure. So what services are actually provided in the umbrella of hospice care?
Well, it's an interdisciplinary care team, which is a sort of a bundle of care, which sort of spans the type of services any patient would need in a care setting. So it's medical equipment, it's the nurses, the doctors, the aides, it's medicine. It's actually a spiritual and a psychological relief, and it's care for the families as well. A lot of people don't realize that hospice is not only for patients but also families. And as a loved one is suffering, and hospice is there to not only care for the patient and make them comfortable, but also care for the family. And after the person passes, there is 13 months of bereavement support as well, bundled into the Medicare benefit.
Well, that's wonderful. So there's a long list of stuff that hospice does. So where typically are all of these services provided?
They are provided usually in the home.
Okay.
About 42% of hospice providers or hospice deaths occur in the home. We found that about 8 out of 10 people surveyed would prefer to die in their home. And so that's where it is administered, and that's where the philosophy sort of takes over. There is also, hospice can be administered in a nursing home. It can, in a lot of places, they have even hospice houses, which are standalone buildings, which have somewhere between 6 to 30 rooms providing hospice care. And they often look like homes, and they have large rooms where families and loved ones can gather while they say their goodbyes. And
there are some of those homes actually in this Metro DC
Yes.
area, as I recall. I know actually there's one down in Arlington I'm familiar with. So that's it. So we talked about who provides the services. It's a whole disciplinary team of professionals, which is really amazing how many people actually get on board to help out here. What type of healthcare organizations can actually provide the hospice services?
So you have to be a Medicare hospice provider. You have to be able to be certified by Medicare or the Department of Health and Human Services and provide the type of care. Private insurers may have other requirements for reimbursement through their insurance, but we know the lion's share of hospice provided is through the Medicare program.
Okay. Now, how long can somebody receive these services once they've started?
So you can receive hospice for up to 6 months or less.
Okay.
You have to be certified as terminal by a physician and then also by the hospice medical director. And then in some cases, a patient doesn't die in the first 6 months, and they have to reevaluate that patient, and then for another 90 days, they're hospice eligible. And at that end of those 90 days, then they have to recertify them again.
Okay. Now, I understand, I know when we were talking about this program, in preparing for the program, you indicated that a lot of people who receive hospice get it for a very short period of time. Why is that?
Well, part of it is the way the benefit is administered. People have to give up curative care in order to take the hospice benefit. And I think it's human nature, you and I would agree, that you don't want to give up something to get something else. But it's unfortunate that people are not taking advantage of this, because a lot of what we hear from both patients and families is, I wish I knew that I could take this benefit earlier. And a lot of people take hospice in the last week of their life, and they are very comfortable for that week, but they sort of wish they had a little bit longer.
And I noticed that I was really surprised to see the high percentage of folks that only get it for the last week of their life. That was really...
Yeah, I think it's over 25%.
That's really saddening. But I can understand why people don't want to give it up, because I know we say we're not giving up hope, but that's what they're effectively saying. They're not going to try to cure. Let's talk about how we pay for hospice services. So we'll go through and talk a little bit, but does Medicare pay for hospice?
Medicare does pay for hospice. It was part of a demo. People who are involved in healthcare policy will talk about demos through the Department of Health and Human Services, actually CMS. And it was a demo to test the program to see if patients and families liked it and whether it was actually a high level and quality care. And it was actually the first demo to become a Medicare benefit. This was
really?
back in the 80s, and then it was made permanent in the tax code of 1986.
Oh, that's very interesting. Now, does Medicaid pay for hospice?
Yes, it does.
We have many people that are on Medicaid.
Yeah, and actually we've found even those who don't have insurance, Medicare, Medicaid, or private insurance, a lot of hospices will take them, will take patients anyway.
That's very interesting. Now, I know you also talked about that apparently some private insurance does pay for Medicaid, for hospice, but it kind of varies by insurance policy?
Correct. But generally across the country, these insurance policies do allow for hospice care.
Well, that's good. That's good. Well, let's turn our attention to this, what I gather is kind of an underused area, which is that palliative care. So tell us, what is the focus of palliative care?
Palliative care is similar to hospice in its care philosophy. It's really treating symptoms. Someone who not necessarily has a terminal disease but an incurable disease that has sort of problematic symptoms. Some people equate palliative care to pre-hospice. It's not necessarily the same thing, but it takes care or takes into account the interdisciplinary team and the person-centered approach.
Okay.
And also does wraparound services for families as well.
Okay. And I guess I gather that this is something that is not widely used, but it's growing.
It is. And actually, NHPCO used to just be the Hospice Trade Association, and we added palliative care about a dozen years ago.
Okay.
And so it is a care philosophy that is becoming sort of more mainstream. There are sort of myriad amounts of knowledge, and this care is talked about at conferences as part of our trade association, but also there's bills in Congress that are going to train more practitioners in palliative medicine. So it is a specialty. It's just one that's not as well known as hospice.
Okay, but it sounds like it's coming. More and more attention is being drawn to it. So who can receive this type of care, this palliative care?
Anyone can. There's no statutory definition for palliative care, which is interesting. Or there's no statutory definition and a Medicare benefit to pay for palliative care. Medicare does pay for it by sort of the code, but it doesn't do it in the same way that it bundles the services for hospice.
Okay.
Private insurers pay for it. I know Blue Cross Blue Shield in California pays for it, as well as many other private insurance providers.
So what services are actually provided for in palliative care?
It's mostly symptom relief, medication, medical consults, physician payments, that type of thing.
Okay. And where are these services normally provided?
They're provided through hospices, but also through hospitals who have a palliative care department.
So would palliative care end once people start into hospice?
In a perfect world, you would never know what you were in, whether you had palliative care, hospice, and you had concurrent care at the same time. But right now, I think people have palliative care and then they transition to hospice.
Okay, I'm sure from a billing standpoint that is an important distinction. And then who provides palliative care? Is it the same folks that do the hospice kind of care, or is it somebody different?
No, they're generally the same folks. They're just trained in this specialty.
Gotcha. Okay. And then what type of healthcare organization can provide palliative care?
All sorts of healthcare organizations, one that's certified to provide this care. But generally you find them in most hospitals, and certainly some hospice companies will also provide palliative medicine.
Do they still have to be certified just like a hospice provider has to be certified?
In most cases, yes.
Okay, so it's not quite as strict yet.
Not quite.
Not quite, okay.
As I said before, there's no statutory definition in Medicare benefit to pay for palliative care.
Good.
We're hopeful that there is one at some point.
Sure.
And we're certainly at a trade association in Washington, D.C., we would like that to become reality.
Sure, sure. How long can somebody receive palliative care services?
There's no time limit.
Okay.
Assuming their doctor gives them a consult and says you're eligible for these services, they can receive it in perpetuity.
Interesting. Okay. Well, we started to talk a little bit about this, but let's go over it again. So let's talk about how we pay for palliative care. So does Medicare pay for palliative care services?
Yes, in most cases it does. It's just a lot different in the way in which hospice is administered as a bundled payment that pays for everything. Palliative care is not paid for in that same way.
So the organization that takes on that care has to be careful as far as how they code the bill when they send it off to Medicare for reimbursement.
Yeah, they do. And as an attorney, False Claims Acts or in Stark and those anti-kickback laws
Sure.
are very well known by our providers and should be very well known by the regulators as well.
Mm-hmm. So they have to be careful and do it correctly. Now, I gather from when we talked in preparing that Medicaid also pays for palliative care pretty much along the same lines.
Yes, they do.
And then some private insurers are now beginning to cover that, or they cover that?
Yeah, I think they have in the recent past, but that more of them are in the palliative care business as well.
Okay. Well, we have some time. Let's go talk about some practical, impact of all of this. In the case of palliative care, when is palliative care typically sought, and who initiates that request?
Well, it's interesting you ask that question. Sometimes it's the patient. Sometimes the physician, for whatever reason, maybe they're not trained or this wasn't part of their medical training.
Mm-hmm.
They won't know to ask for a consult. And so a lot of times it's really person-driven or patient-driven where they're asked for a palliative care consult.
Okay. So patients and the family should not be reluctant to bring it up.
Absolutely. They should bring it up.
So Mark, what kind of issues do families typically encounter when they're seeking coverage for palliative care?
Well, assuming it's covered, there's usually not a lot of issues that they have.
That's good.
But in some cases, people aren't very familiar with what palliative medicine is, so there's sort of a learning curve to understand, what it encompasses, what it covers, and what it doesn't. And so, it would be a lot easier that if there was a statutory definition for palliative care and a Medicare benefit to pay for it, just like there is for hospice, that you wouldn't have sort of the questions and the whole payment philosophy that goes around with them.
Okay, well that's something that you're working on, get that solved. Let's turn to hospice. In the case of hospice, when is hospice care typically sought and who initiates the request?
Usually a patient can make the request or their family, but often it's a physician. Physicians are very familiar with hospice care, and they know when the patient's illness is generally terminal, and they're eligible for up to 6 months of care. That is renewable, but that is the way in which it's administered.
Okay, so the key with hospice, though, is that you do need that doctor to certify.
Yeah, you need actually 2 doctors. You need your
2 doctors.
Yeah, usually the primary doctor, and then you need the medical director of the hospice to agree with the primary doctors.
So if we don't get that, then we're going to have a problem getting that approved. Do either of these programs offer support of any kind to the families of loved one receiving the care, whether it's palliative or hospice?
Yes, the family is taken into account, and that's sort of unique about this care model, is that it's person-centered, but it's also family-centered, where you're taking into account a lot of the needs of not just the patient, but the family. And I'll give you an example. One of the levels of care in hospice is respite care, which is where, say for instance, you're terminal and you're in your home and you're being cared for by a nurse and an aide and a doctor and a caregiver. Say it's your wife or your son or daughter. Say for instance you need to get some remodeling done in your house, or your loved one needs to go out of town for a wedding and they're not going to be there to care for you 24 hours a day. There's the ability for you to go inpatient in another facility to be cared for while that person has a break, and we call that respite care, which is also caring for the family member who's the caregiver. So
critically important.
Yeah, hospice and palliative care is not just about the family, oftentimes it's also about the caregiver.
That's really important. How do families or court-appointed guardians find a healthcare organization that provides palliative care or hospice care in their community?
Well, they can go on our website, nhpco.org, and there's a hospice finding tool, or they can go into caringinfo.org as well, And then CMS has a website where you can, called Hospice Compare, where you can find hospices based upon your geographic location.
Okay, so that's good. That's good references. Now, how do families or court-appointed guardians determine which healthcare organization is the best one to provide that kind of care?
Great question. Some of the surveys done by these hospices are actually on Hospice Compare.
Okay.
Not the survey results, but there's a limited amount of survey information that's up there. Some states provide more than others.
Okay.
But they can also talk to people in the community, talk to your physician and your provider who they recommend. And a lot of times, people are familiar with the hospice providers in their community and know which ones provide great care and which ones don't.
I think that actually is a very good suggestion, because what we found among all the care providers and care managers that we deal with in our practice, that they know who are the good ones, and they also will tell you that a lot of times it may be good because there's one or two people there, and these people do move around. And if they might leave an organization, it may change the complexion as far as the care being delivered. So yes, it is a good idea to ask around and talk to people. What support is available for family caregivers? We talked a little bit about this, but maybe spend a couple more minutes talking about that.
Sure. So you have bereavement support. I talked at the outset, you have the respite care, but when a person dies, and actually even before they pass, you have some psychologists and some bereavement experts that are there to counsel the family. And I know, in a lot of cases, you have sort of specialized programs for hospice who have camps and specialized programs for children who have lost parents or loved ones as well. Mm-hmm. And so that's a sort of a newer type of service, but it's one that a lot of hospice providers are engaging the community with.
That's wonderful.
And actually, the interesting thing about hospice is that hospice providers will often provide bereavement support not just to people who are beneficiaries of hospice, but also others in the community when there's, say, a death related to opioids, or a mass casualty event, or a natural disaster. Huh. And they'll be there because they're experts in providing this type of care, and will often go into their own pocket to do it. I know in an instance I was visiting with a hospice provider in Sarasota, Florida, and the CEO told me that they provide $1 million of free bereavement support to the community in a given year.
And it's interesting too, bereavement support, that actually is a special skill. It's not just being a nice person and trying to comfort them. There's actually ways to react to different things that occur during that grieving process that you actually have to be trained in.
Yeah.
So
it's a very difficult job, and I take my hat off to those who are those frontline caregivers.
Well, I want to thank you, Mark, for taking the time coming over and visiting with us and telling our viewers about hospice care and palliative care and all the things that your wonderful trade association does to support that in the community and across the country. So thanks again for taking the time.
Thank you very much, Richard.
You're very welcome. Without a doubt, caring for an aging adult can be challenging. Our show this evening introduced you to both palliative care and hospice care. I suggest you discuss with the medical team caring for your loved one whether either or both of these care options may be appropriate. And if either are recommended by the medical team, there are many providers in our community who stand ready to help. These providers and their staff are caring, thoughtful, and passionate about the care they provide. When the time is right, I encourage you to reach out to a provider near you to discuss your loved one's situation. This brings us to the conclusion of our show this evening. We hope you found it helpful. Replays of this show and all the shows broadcast to date, along with other helpful information, can be viewed on the Probate Nation website. On behalf of the Probate Nation, thank you for visiting with us.